Just a minute, sir. I have to make you. Just a minute, sir. I need to make you. Oh, oops. Just a minute, sir. Yes, sir. Yes, sir.
I'm still unable to share it.
Okay, just a minute, sir. Let me see. Just give me 2 minutes.
Yeah, please. So what you have understood so far by the term yoga therapy? Can anyone? What is your understanding? Yes, anybody can unmute, and there is nothing wrong or right. Something.
When we just use the yoga tools to meet the purpose of therapy.
Very good. When we utilize. Yes, please, Tanuja ji.
योगा का मतलब अंतिम ध्येय मोक्ष है, लेकिन अभी जो भी मतलब मॉडर्न डेज में वो मतलब अभी जो डिसीजेस हो रहे हैं मॉडर्न हमारा लाइफस्टाइल है उसकी वजह से, तो योगा का जो भी फिलोसॉफी है और जो भी उसमें आसन प्राणायाम और फिलोसॉफी उसकी सहायता से हम वो डिसीज के ऊपर क्योर करने की कोशिश करते हैं.
Sir, yoga therapy is an alternative therapy without medicine or without side effects. अगर proper तरीके से किया तो.
Drugless and having no side effects. Yes, Pratibha ji.
Treat the patient according to their physics, their habits, and what exactly treatment he need. According to that. It's yoga therapy. I understand so.
Yes. So you all have already know what is yoga therapy, isn't it? So.
Sir, yoga therapy, it is work as a holistic approach which focus on the physical, mental, and emotional level of an individual.
Very nice. Very nice.
सर किसी भी परेशानी को योगा के आसन प्राणायाम और क्रियाओं से दूर करना ही योगा थेरेपी हुआ शायद.
What is yoga therapy? So essentially, when we use term therapy, okay, it is essentially to manage some disease, to prevent the disease, and also to cure the disease. Okay, these are the three aspects of therapy. Okay, now whenever we use yoga or any component of yoga, whether it can be asana, pranayama, meditation, or any kriyas, for the purpose of prevention of the disease, or it can also be promotion of the health. Okay? Promotion of the health, prevention of the disease, or to manage the symptoms of the disease, or to cure the disease. Okay, it is called yoga therapy. Okay, otherwise yoga is not a therapy, isn't it? It's not yoga, it is actually yoga. Okay, is yoga. Yoga chitta vritti nirodha, isn't it? It is a yoga. What is yoga? What you have understood by yoga in your terms, in your language?
Yoga means union.
Yoga means union.
Yoga means union. Okay.
A union of breath, mind, and body.
Very good.
Connect individual consciousness to the supreme consciousness.
आत्मा परमात्मा का मिलन.
Very good. Now, some of you have said that yoga is union. Okay. Yoga is union. It is the literal meaning of the word yoga. Okay. Whenever we use term yoga, so yoga का literal meaning जो है वो है union. Okay. But in the context of yoga philosophy, it is little bit different. Okay. Now, when it comes to therapy, how we define yoga? Yoga is connection of mind, body, and breath. Yes, it is true in the context of yoga therapy. When it comes to the context of philosophy or context of spirituality, it is the connection of the individual soul with the universal soul, or connection of the Atma with Paramatma. Okay, so it has many aspects. Okay, yoga is not the one. If you see yoga from different angles, it is different. It becomes therapy from one view. It becomes spirituality from one view. It becomes the practice from another view. This is very beautiful thing. So whenever it comes to therapy, it is connection of mind, body, and breath. Okay. Why we say in therapy it is mind, body, breath connection is important? Because any disease is disorganization or miscommunication between the mind and body. Okay. Between the mind and body. In fact, we define these psychosomatic disorders or non-communicable disorders are the complex interaction between the mind and body. Okay. When mind says something and body does something, and when there is a mismatch, okay, or when the mind, unhealthy mind, drives the body, that leads to disease. Okay, so there is a disconnection, there is a disorganization between the mind and the body, that is the disease. Okay, to cure that, we have to make it organized, make it connected, Okay, so this connection process is yoga therapy. Connection. So in that way, it is connection. In that way, it is union of mind, body, and breath. Why union is necessary? Because non-union of these three is the disease, and union of these three is a health. Now we want to go from unhealthy state to the healthy state. Okay, or we want to prevent becoming unhealthy by ensuring the connection of the mind and body. Okay, I will share my slides and we'll Can all of you see my slides?
Yes, sir. Yes, sir. Yes, sir.
So we learn the concept of yoga, how this yoga therapy concept came into picture, and what is the necessary of talking about yoga in this modern times. Okay, that we will understand. So as Jagdish has introduced, I'm an assistant professor in the Department of Yoga, Central University of Rajasthan, and I have done my graduation in Ayurveda, and I did my post-graduation and PhD in yoga therapy. And my topic of PhD was how yoga can help in patients with hypertension. Okay. Now, all of we know that nowadays we are living in the modern era. In fact, this is the most luxurious time or most luxurious era that human has ever lived on this earth, isn't it? What not we have? Isn't it? We have everything. Everything is in our fingertips. Okay, we heard of like all of we know that the heaven is very beautiful. Earlier days, people used to have their own flights like Pushpak Viman and all that. All that we have nowadays, isn't it? All that we have nowadays. And this is the most comfortable, luxurious life we are living. Okay. We have lots of facilities. Okay. Everything is on our fingertips. So we can switch on, switch off fan, we can control temperature, we can control the satellites going from Earth to Moon or Earth to Sun, isn't it? So just on our fingertips. Not only that, we have very advanced medicines. Okay? We have vaccinations to prevent infections. We have sophisticated surgeries. We have emergency care. Okay, so from all way we are very much protected. Okay, so earlier days the humans used to live in the jungle and they used to every time they have this terror of animals coming and attacking. Isn't it? Now we have overcome that phase. Now we are living in a most secure place where forget about lion, tigers, even mosquitoes cannot enter in our house nowadays. Isn't it? We have all these mosquito repellents, we have nets, all that. Now, so with the advancement in the technology, with the advancement in the living, with the advancement in the medicine, the average lifespan of the human has increased from 40 to 75. Okay, so earlier, when our ancestors used to live in the forest, they used to live hardly up to 40 years. But nowadays, the average lifespan is 75 years. Now it is in India, I'm talking. So if you go to Europe countries or some other more developed countries, there it is little more, like 80 to 85. Child mortality rate has decreased drastically. So earlier, the deliveries used to happen in the home and there was a lot of risk of child mortality. But nowadays, we have overcome child mortality, isn't it? So mortality due to infectious diseases, not so far long, just recently, like 50 to 60 years, we had a very serious infectious diseases, isn't it? Like you might have heard cholera, plague, isn't it? All these disorders are they were pandemics, and if the cholera or plague comes to a village, all village used to die, isn't it? The whole village used to die. Such a terrible diseases these were earlier days. But fortunately, thanks to modern medicine, that invention of the medicines, invention of the antibiotics, invention of the vaccines, we have overcome all those infectious diseases. Okay. Now, though we are very comfortable, though we have a lot of medicines, everything is there, but still we have some problems which were not there earlier. But these are the problems of modern era. What are those? What are these problems? There is a origin of concept of no time, isn't it? Earlier also people used to have 24 hours. Now also people have 24 hours, but now there is no time. No time to self-care, isn't it? In fact, many people comes to us saying that I have this problem, I have that problem. You tell some yoga, you give some Ayurveda medicine. Now we ask them to just give your every day half an hour for yoga practice. Then they say, no, I can't afford half an hour So morning they use start telling morning I have to get up this time, I have to go to office, I have to do this thing. So whole day they cannot find half an hour for them to practice yoga. This is the condition. Then forget about family and children. Okay, there is no time for themselves. Okay? If at all time is there, they spend with their friends and they have a lot of other works to do. So gradually humans, gradually people are becoming like they are okay if they are busy, and if they are not busy, if they don't have anything to do, they become confused what to do. If they go to their family and children, they become bored. What is this? This is not, because they have their system, their mind, their body has forgot how to live with the family, how to spend time with the family, how to behave with the friend. They have just forgot it because they are no more living with that. They don't know what to do with the family, how to spend time with the friends. Because so whenever they are free, they try to do some work. You might have seen, like the engineers or the other office workers. So Saturday, Sunday, they become restless. Saturday, Sunday, they don't know what to do. In fact, one of my friend's family. So when he is Saturday, Sunday, he has a leave. So when he is there on the home, so all his kids and wife, they are enjoying. They cook something, they eat, they watch TV. He become very irritated. What these people are doing? So whole day they are watching TV, they are eating something. They don't have any work to do, isn't it? He shouts on them. Then they people say that why this Sunday, Saturday comes? Okay, why Papa comes to home? He should be there in the office itself. So why this is happening? Because they are unable to disconnect from the job and connect with the family. Okay, so this is what is the condition. Lack of mental peace, lack of rest, lack of trustful relationships. We have a lot of people whom we know digitally, in fact, now personally also, but there is no strong trust or faith on them. Okay, that is the problem. Then there is a competition.
So your PPT is not moving, I feel.
Oh, it is there. I mean, on the same PPT I'm talking.
Okay, sir.
Competition. There is a lot of competition nowadays. Even simple fun, some games, everything, if it is there, that is turned into competition. Okay, so even the parents of small children, when they are playing with the other children, they have this competitive vision. Okay, so my kid is doing better, that kid is not doing better, or that kid is doing better. Competitive mindset has taken place. Okay, craving for name, fame, all these politicians, all these famous actors, what they are doing is they are craving for name and fame, okay, which is not a good thing. In addition to that, we have a lot of air pollution, we have adulteration in the food, water, unhealthy and healthy products, even a lot of Ayurveda medicines, in fact, a lot of drugs, they are adulterated nowadays, isn't it? So we have to be with very carefully nowadays. So these all things have led to non-communicable diseases. Okay. So earlier we used to face communicable diseases: cholera, plague, dengue, malaria, chickenpox, measles. All these were the major problems, malnourishment. But nowadays, those problems are not there, but we have very different problems. We have problem of non-communicable diseases. Diseases like heart disease, cancer, arthritis, back pain, anxiety, migraine, isn't it? All female uterus problems, breast cancer, okay, PCOD, anxiety, depression, anger issues, personality disorders. All these disorders have become very prevalent, okay, very common. Okay. So these are the major health issues nowadays. Okay, non-communicable disorders. Yeah. Now, modern medicine has not stopped there itself. Now we are becoming more advanced in the medicine also. We have numerous medicines. So if you go to hospital, you have variety of, there is no one medicine for hypertension. There are many medicines. There are n number of antihypertensives, n number of anti-diabetic medicines, anti-migraine, painkillers. Okay. So antipyretics. We have many anti-medicines. Okay. We have super specialties, sophisticated surgeries. We have robotic surgery nowadays. We have super specialties now, like heart disease. In the heart disease, specifically for vascular disorders, specifically for cardiac muscle disorder, specifically for conduction problems, specifically for brain surgery. We have surgeons for left eye, right eye, isn't it? So we have super specialties. We have gastroenterologist. We have oncologist. We have ENT specialists. We have psychiatrists. We have specialists who are dealing only with anxiety disorder, only with depression, only with schizophrenia. Okay. Such a specialties we have nowadays. We have dietitians, sports facilities and persons. We have exercise therapists. We have counselors. Lot of awareness about all these things through digital media. So earlier people used to, so they did not know all these things. I mean, if at all there were facilities, they were not aware. But nowadays we have facilities and we also very much aware of it. Okay. Even the remote village people know that such facilities are there in the city or such and such place, and they have access to those places also. Okay. Now, in spite of it, what is the limitation? Unfortunately, none of these medicines, none of the antihypertensive medicines, they cure the hypertension. None of the anti-diabetic medicines, they cure the diabetes. No PCOD medicine will cure PCOD. No thyroid medicine will cure thyroid. Okay. So none of those medicines are cure for any disorders. You have to take them as long as you live. So once a person gets thyroid hypothyroidism, so she has to take thyroid medicines throughout her life. Okay, so that brings drug dependency. Okay, and that is very discussing for the patient. Now it is okay if early morning I have to get up and I have to take medicines. Okay, fine, we will take it. Dependency is there. Okay, we will bear it. But the thing is, these medicines have a lot of side effects. Okay, so if a person with depression, if you give a medicine for depression, so he takes medicine. After a few months, he starts developing tremors. Now, doctor will prescribe one more medicine to stop those tremors. Now, earlier he used to feel depression, so he takes medicine. Now he is not feeling depression, but the side effect of it is he is not feeling joy also. He is there. He is just like a robot. Okay? So there is a lot of fun going on. There is a lot of happiness in the home, but he is unable to feel it, because what this medicine do is they just cut you off from feeling. Okay, you are feeling depressed. I will cut your feelings. You don't feel depressed. But in that, he is not feeling joyful also. He cannot smile like a normal person, even though he is taking medicine, even though he's not having depression now, but he is not living also. He feel like I'm a robot. I'm not feeling anything. Okay, I'm not feeling any emotions. That is the major side effect. In fact, sometimes these side effects are so severe, patient says that I can bear this disease, but I cannot bear the side effect of it. For example, cancer. You might have heard, in fact, you might have seen many people suffering it, that the cancer side effects are worse or more painful than the cancer itself. Many cancer patients say that I'm happy to die with this cancer, but I cannot tolerate the side effects of the cancer therapy, like chemotherapy, radiotherapy. This is the condition. Same thing is there with all the drugs. In fact, there was a survey going on which tells that if we give one antihypertensive to 100 people, okay, 25 of them they get satisfaction. I mean, satisfactory results. 25 they say I'm not completely satisfied, but 50% is satisfied. Another 25 say that there is no any change. Even if I take medicine, the blood pressure is same. Even if I don't take the blood pressure, no effect at all. And remaining 25 patient, they took medicine and there is no change in the blood pressure, but there are a lot of side effects. So these medicines help only 25% of the patients. Rest 75% of the patient, they are not either completely not satisfied or there are a lot of side effects. Okay. In addition to that, they are costly. Nowadays, there are a lot of companies produce the same chemicals, but the cost is very much different. Okay. So in government, if you go the same medicines or same salts they give with 60 rupees for 30 tablets. If you go to some private, they will take 400 rupees for 30 tablets. This is the difference. So they're not cost friendly. They are not cost effective. Okay, they are costly. In addition to that, they reduce the quality of life. Okay. Modern medicine has definitely increased our lifespan, but failed to improve our quality of life. Patients are there, they are living, they are managing everything, but they are not satisfied with the quality of life they are living. Okay. That is a very unfortunate thing. And they are very poorly satisfied with the modern medicine. Okay. So these are the limitations of the facilities what we have to overcome the disease. Okay. In addition to that, modern medicine never speaks about prevention. Okay. So if you have this disease, we will give this medicine, we will do this surgery. No, I don't have any disease, but I want to promote or prevent this disease. Or prevention itself, there is no intervention. If it is a promotion, they have nothing to offer. Okay. So that is where the modern medicine has failed. Okay. Despite we have all these medicines, there is the NCDs are the leading cause of the disease. Non-communicable disorders like hypertension, asthma, COPD, cancer, isn't it? So all these disorders are leading cause of the death. Okay. Earlier, people used to die with the accidents, snake bites, or some infections like cholera, malaria, all that, or malnourishment. These were 4 things. But nowadays, none of the people are dying because of those things. The 80% of the people die because of the non-communicable disorders. So in that, heart disease is the leading cause of the death. Okay. Heart disease, after that, the lung disorders, and then cancer. These are the leading cause of the death nowadays. Okay. And the non-communicable disorders have become healthcare burden. So WHO is also focusing on how to overcome the non-communicable disorders, what to do. Okay, so that is the major thing it is happening, and there is a lot of premature deaths nowadays. So people earlier used to get heart attack after 60s, 70s, isn't it? But nowadays, people at the age of 40s, 35, there are records in the heart hospitals that people with 30 years of age coming with the heart attacks. Okay? So premature deaths have become increased nowadays. Okay. Now, why this failure of the modern medicine is? What is the reason? The reason is lack of understanding. Okay. Lack of understanding about the cause of these diseases. Okay. The modern understanding of the disease is, what is disease? Disease is just a chemical imbalance in the body. So some chemical imbalance has happened. We have to use the external chemicals to balance that imbalance. This is what is the understanding of the modern medicine. That is where the failure is. Okay. So modern medicine never understood the importance of mind-body interaction. There is a mind which has an influence on your body. Okay, and that influence is very severe, and to the extent that it can help you to prevent the disease, promote your health, or same can cause the disease. Okay? So this understanding they have never understood. In fact, the modern medicine started accepting there is a mind, there is a psychology, just since last 100 or 150 years ago. Earlier, there was no concept of mind. If anybody says that there is mind, there is psychology, they will get punished. They don't talk such nonsense things. Okay? But now recently, the modern medicine started understanding the importance of the mind and its role in the disease. Okay. Now mind-body medicine is a leading branch of the healthcare system. Now currently, modern medicine has also accepted that these disorders are not just the chemical imbalance in the body. The cause of the chemical imbalance in the body is our lifestyle. Okay. Our lifestyle is a major thing that contributes the disorders. Okay. So what is the cause of the non-communicable disorders? It is unhealthy lifestyle plus genetic predisposition. Okay. We call it as a complex interaction between the environment and the genetic predisposition or lifestyle. Okay. So lifestyle and our genetic makeup is, they both together play a vital role in the cause of these disorders. Okay. What is genetic predisposition? Genetic predispositions, we have a genes. Okay. We have a genes in our body. We have genes for everything. We have genes of eyes, we have genes of nose, we have genes of skin, isn't it? For every function also we have genes. Similarly, we have genes of disorders also. Okay. We have genes of cancer, we have genes of hypertension, we have genes of heart disease, we have genes of migraine, isn't it? All that is there. But every one of us have those genes, but only few of us will develop those particular diseases. Why that is so? Now, what determines that those genes to express or to become active is our lifestyle. Okay. When you follow a certain lifestyle that promote a certain genes and leads to certain change. For example, if one of the parent is having obesity, okay, is having obesity, that means the obesity genes are there in the child also. Now that doesn't mean that he will surely 100% he will develop obesity. He will develop obesity only and only when he follow a certain lifestyle, like he sleeps in the daytime, he keeps himself awake in the night, he eats junk food, and he don't exercise, then his chances of becoming obese will be very high compared to the other person whose parents are not having obese. Okay, we always say, अरे वो भी इतना खाता है लेकिन उसको कुछ नहीं होता है, मैं तो थोड़ा थोड़ा ही खाता हूँ फिर भी मैं obese हो गया हूँ. So what determines is your gene. You are already genetically active for certain disorders. Okay, so this is what is the gene actually does. But that doesn't mean that if you have genes means surely you are going to get the disease. No, only your chance of getting that disease are little higher, but that is still under your control. If you want, you can always prevent it by following a certain lifestyle. Okay, so lifestyle is a very important thing which is there in our hands. Now, what is unhealthy lifestyle? What is lifestyle means is, what is lifestyle? Can anybody define lifestyle?
So lifestyle means the way of living, like your sleep pattern, your diet, and your regular timing of sleeping, a particular time of sleeping. These all are including in lifestyle. How you behave, your thought pattern, how you think.
Very good. Any other simple definition?
Sir, style मतलब daily routine, individual daily routine.
आहार विहार विश्रांति.
Yes, what we do from morning to next morning, okay, in 24 hours, that on regular basis, okay, that on an average regular basis is called as a lifestyle. Lifestyle is what you do daily. Okay, what you do daily. Now, what we do daily we eat. Okay, regular things, what we do is daily we eat. Daily we don't travel, isn't it? Traveling is not our life. So daily we eat. Daily we sleep. Daily we do something, I mean, we do some job. Okay. Daily we, and some people do exercise, some people do habits, addiction, isn't it? So whatever you do on daily basis is your lifestyle. That essentially comprises food. Okay, that essentially comprises food. Ahara. Okay. There is a beautiful shloka from Bhagavad Gita. Yuktahara viharasya yukta chestasya karmasu yukta swapnava bodhasya yogo bhavati dukkha. That means yukta. Yukta is balanced. Yukta is moderation. Okay. Yukta is a healthy quantity. When you eat, sleep, do physical activity, and behave in a balanced way, in a moderation, in a healthy way, that keeps you away from the disease. This is what the meaning of that particular shloka. That gives a clue that how important lifestyle is. Now, recently, after suffering all those diseases, after discovering medicines, and after failure of those medicines, modern medicine started talking about the lifestyle. But look at our ancestors. Okay, many 1,000 years ago, they have very nicely quoted it in the shloka. That is yukta. Okay, yukta is very important. Now, how we define yukta? Okay, now yukta is not now we should not think from modern perspective. Okay? Yukta means yes, 20 ml water. Yukta means 2 liters of water. is yukta. No. Yukta means 1 meal. Yukta means 2 meal. Yukta means 1 hour exercise. Yukta means 8 hours of sleep. No. Yukta varies from person to person. Okay. For me, it may be 2 liters of water is good, but that doesn't mean that you all should take 2 liters. It varies. The yukta quantity varies from person to person. Now we have to identify what is yukta for me. It is a personalized medicine. It is not general medicine. Okay, it is always a personalized medicine. Our ancestors talks about tridosha. Our ancestors talks about triguna, isn't it? So all this tridosha, triguna, what they say is this is personalized. Okay, this is personalized. If you are of kapha prakriti, you should take this much of food. You should take these types of food. You should do this much exercise, and you should sleep this much. If you are vata personality, you have different measurements. You have a different lifestyle. And if you are a pitta person, you should have different lifestyle. Okay, lifestyle is not always same for everyone. It is always different. And so how is that difference? It depends on which prakriti you are. Whether you are vata prakriti, pitta prakriti, kapha prakriti, or you have a combination of prakritis. Now triguna. Okay, so profession. Which profession is good for whom? That should be based on your gunas. If you are a rajas dominant person, jobs like police is very good. If you are sattva kind of personality, jobs like doctor, jobs like yoga teacher, jobs like counselor are very good. If you are rajas kind of personality, jobs like these travelers, drivers, jobs like these delivery boys. So such jobs are very good for vata persons. Now, if these jobs are interchanged from vata to pitta, pitta to kapha, then it is going to cause a lot of problems. Okay? So this yukta differ from person to person. And I have to identify what is yukta for me. I have to identify what quantity of food is yukta for me. You should not say that, oh, my auntie, my friends, all they take 2 chapatis and they all are healthy and I should also take 2 chapatis. No, maybe for you it requires 4 chapatis. Maybe your yukta is maybe 1 chapati. That you have to identify. How to identify? So very nicely Ayurveda gives that. So when we have a food, after having a food, you should not feel drowsy. You should feel contented. Your breathing should be normal. Some people, they eat food, after they become breathless. They are unable to breathe comfortably. So that much they eat. No, that is not a healthy way. You should eat. In fact, they give a quantity, like you make 3 compartments of your stomach. 1 compartment solid, another compartment liquid, and 1 more compartment should be kept empty. This is what is the recommendation. Okay. And when to take food. Okay. So we have this fixed times. So 8 o'clock breakfast, 1 o'clock lunch, again 8, 7 o'clock dinner, isn't it? That's not the right thing. Ayurveda says eat. There are certain symptoms they give. When you feel light, when you start feeling hungry, when you urinate, you defecate, or you gas are passing comfortably, you are feeling completely light, okay, and you feel hungry and you feel thirsty, that time you should eat. Okay? Otherwise, you should not eat. So when we have practice of eating without hunger, then the disease develops. Then the disease develops. Unhealthy lifestyle, unhealthy food in terms of unhealthy quantity, in terms of unhealthy frequency, in terms of unhealthy timing, in terms of unhealthy quality. Okay. Now, whenever we say unhealthy food, that means we focus on, oh, we should not eat pizza, we should not eat burger, we should not eat this, we should not eat that. No, not only that. You should not eat this frequently. You should not eat this much quantity. Okay. So that is also very important. Okay. How many times in a day you eat? Like Ayurveda says, a person with kapha should eat once in a day. A person with vata, a person with vata should eat small quantity of food 4 to 5 times in a day. Person with pitta should eat heavy meals 3 times in a day. If all these persons follow one same thing, then all of them, they are going to become a disease. So every individual prakriti is different and we should follow different patterns. Okay, this quantity, quality, frequency, all has to be taken care. Okay. Then unhealthy behavior. Okay. Unhealthy behavior is like some people, they sleep in the daytime and they wakeful in the night and they see movies or chit chat and all those things. That is very, very unhealthy. We should sleep and our sleeping pattern should be regular. And you should also check that whether you are sleeping, whether your sleep is good, correct or not. So when we say my health is sleep, my sleep is good, when you go to bed, within half an hour, you should be into your sleep. If you are taking more than half an hour or 45 minutes to get into sleep, that means there is some problem with your sleep. Next is, when you once go into sleep, there should be deep sleep. In fact, in between, if you wake up for washroom, and after that you again go to bed, you should get sleep immediately. Okay. Again, that time also you are waiting for 45 minutes, 1 hour, means your sleep is not good. You have to rethink. You have to investigate something. And the third thing is, when you wake up in the morning, you should feel fresh, light. You should feel like, oh, what a wonderful sleep it was. And your body should be like light, as if you are floating. Okay? You should feel enthusiastic to work. You should feel fresh to do something. Okay, that enthusiasm should come. The enthusiasm is a health. Just like children are very enthusiastic. Okay, they are never bored. Okay, they are never tired. They are always enthusiastic. If you live anywhere, they start searching this thing, that thing, because very healthy body. Okay, so enthusiasm should be there. You should feel light. You should feel fresh. After getting up, you are feeling drowsy and you are not interested in doing the things. You are feeling very hard to do things. There is a lot of resistance from inside. That means your sleep was not good. You might have slept for 10 hours without interruption, but your body has not achieved complete rest. You have to rethink about it. Then exercise. Okay, so exercise, people have a lot of confusion. How much exercise should we do? Okay, so what type of exercise we should do? That is the very confusing. So Ayurveda recommends very nice thing. So people with Vata, they should do minimum exercise. Okay. People with Kapha should do more exercise. People with Pitta should also do more exercise. Okay. Now, how much exercise we should do? You should do exercise till you sweat on your forehead. Okay. You should not sweat profusely. Profuse sweating indicates stress to the body. Okay, Ayurveda recommends you should exercise till you sweat. It also recommends you should do exercise with your full capacity in the winter season and you should do minimum exercise in the summer season. Summer season you should do less exercise. Winter season you should do more exercise. Naturally, in the winter season, if you do exercise, you will sweat after late. So in summer season, even if you do four jogging, you start sweating. Okay. So sweating is a best indicator what Ayurveda says. And your breathing rate should increase. You feel like, isn't it? All those things will be there, and you should rest after that. Ayurveda also recommends yoga postures, asana. They specifically mention asana should be practiced. Okay. Now asanas are not like exercise. Okay. Asanas are completely different. Okay. Asanas are not even stretch exercises. Even though stretch exercises involve stretching, but that is different. How asanas are different? When we do asana, we actually stretch our skeletal muscles. Okay? We stretch our skeletal muscles. See the beauty, see the depth of the asana. Asana is not just a posture. When we have any posture that brings the stretch in our voluntary muscles, and in these voluntary muscles, there are stretch receptors which are directly connected to our brain. Okay. So whenever a certain muscle undergoes stretch, the stretch receptors there, they go to brain and tell the brain that, oh, that muscle is under pressure. It is having a lot of stretch. It is having a lot of pressure. Please relax that muscle.
So unmute yourself, sir. Unmute yourself, sir. Let's wait for a minute so that it's not comes back. This network issue. Okay.
Hello.
Yes, sir. Yes.
Am I audible now?
Yes, sir.
Yeah, sorry, there was some. Okay. So what I was telling?
Stretch receptors.
About the asanas.
Yes. So there are stretch receptors in the muscles which goes to brain and tell the brain that that muscle is under pressure. You please relax that muscle. Now what brain does, brain cannot selectively tell that muscle that you relax. So brain eventually tell whole body that you relax. Okay. How it tells? Via endocrine system. It helps to release endorphins. It releases melatonin. It releases oxytocin. These all are the happy hormones. These all are positive hormones. Now, although all those hormones are released and body becomes, that particular muscle become relaxed, in addition to that, heart also get relaxation. Respiration, the lungs also get relaxation. Our digestive system also get relaxation. Our nervous system also gets relaxation. That is the beauty of the asana. Asana is not just stretch exercise. It is a stress. Provided you should do asana in a way that should be done. How? You have to very gradually go to posture. Okay? Very mindfully. Very important, very mindfully. When you do asana without your mind, only at the physical level, you will get only half of its benefit. When there is a mind, when you are mindful about your practice, then you will get the 100% benefit. That is why in asana we always tell that you should raise your hand very slowly and slowly bend. And after bending, after achieving that particular posture, you have to close your eyes and you have to focus on your breathing. Take a deep breath, breathe out slowly and slowly relax. And now slowly go to the muscles that are being stretched. Feel the pain, feel the stretch. Okay. Now slowly release and slowly come back. This is what is the way we should perform asana. Not that we are just raising our hand and touching and coming back. Okay, that don't have any, I mean, that have just the effect like stretching, but it will not have a deeper effect what actually the asana is. Okay? That is what the procedure of performing the asana. While performing asana, there should be slowness, there should be awareness, and there should be mindful breathing. Okay? Mindful breathing. These all are should be there. Then only it is asana. Otherwise, it is just an exercise. You'll get the benefit of the exercise, but you will not get the benefit of the asana. Okay, that we have to mind. Then a lot of people have addiction. Now, addiction is not necessarily mean that the alcohol or like smoking. Nowadays, we have a lot of other socially accepted addictions like mobile, isn't it? And we have addiction of munching something. So some people cannot just sit like that. So they have this chewing gum. They keep munching it. That is addiction. Okay. What is addiction? Can anybody define addiction?
Sir, something without which you can't function your normal routine, your normal lifestyle. That's addiction.
Yes, very good. Yeah. That cause you dependent. Okay. Whenever you have a dependency, that means that is an addiction. Okay. Earlier, I mean, before you get into addiction, it was a pleasure. Okay. So, like chewing gum, when you first time eat, it is a pleasure. Now that pleasure become dependency. Then the pleasure get turned into addiction. We have a lot of addictions nowadays. Some people have exercise addiction. Some people have mobile addiction. So nowadays people have, so when they go to sleep, I mean, when they go on the bed, then unless and until they watch certain time, maybe half an hour or maybe 1 hour, they watch something, they don't get the sleep. So recently I gone to my hometown. So my nephew, who is of 4 years old, okay. Now so I was sleeping and he came to me. He said that I will sleep with you today. I said, come and sleep, and we were sleeping. And after that, he is not getting sleep. He started doing chumu. Then after that, he gone to his mom and he brought mobile. Okay, he started watching mobile. Okay, I saw he watched mobile half an hour, and after that he slept. That is the addiction. That is the addiction. Now we have to assess ourselves. What is that without which I am unable to sleep, or I am unable to enjoy my life regularly. Okay, so that can be of any form. Then unhealthy emotions. Unhealthy emotions. We talk about thoughts. Okay? So some people say that we should not have negative thoughts. We should not think negatively. Don't say that. Thoughts comes from the emotions. I mean, deeper emotions. So if you are getting negative thoughts, that means you have negative emotions inside. And those negative emotions are not like you intentionally generate them. They are being generated by the behavior that the people around you have made with you. Okay. So have a sympathy when you are working on your mind. So sympathy, self-compassion, we say it as. Okay. Self-compassion is very, very important when you work on your psychology. Okay. So whatever is happening inside you, whether it is a negative thought, whether you are getting jealous about somebody, whether you are getting angry about something, have a self-compassion. Okay. Okay. I got hurt. Okay. That's why I am getting anger. I got hurt. That's why I'm getting jealous. I got hurt. That's why I'm getting, I'm feeling depressed. Okay. So you have sympathy. You talk to others. Okay. Talking is very, very important. Crying is very, very important when we come to our mind. Okay. So never try to change your thought. Never try to change your thought patterns. You can't do it. Try to see the emotion behind that particular thought. Okay. If you are getting the thoughts like scolding somebody, hitting somebody, that means there is an anger behind that. You are getting the thoughts which are negative about yourself, which are like which are dominating on yourself. That means you are being hurt, you are depressed. Okay? You are getting thoughts about fear of something. That means you have an anxiety within you. You have to work on anxiety, you have to work on depression, you have to work on aggression or anger that you have within you. Okay? Now those emotions are actually creating the thoughts. Okay? So never hurt yourself that why I'm getting such a thoughts, why I am always negative. No, you are not always negative. Okay? You have some negative emotions, okay? And you have to work on it, and they are very easy to cure. Okay? So you have to talk to others, talk to people who are very near and dear to you. What is unhealthy food? It's a fast food necessarily. Okay. Fast food, it is refined. Okay. What is refined? Refined is something which is very fine. Okay, very fine in consistency. I say it, very fine in consistency. Just like rock salt and refined salt. Just like wheat flour and refined flour. What is wheat flour? The fiber part and the protein part of it is taken, and whatever remains is the maida, okay, which is refined flour. So anything refined is not good for your body. So I say anything is refined is not fine. Okay, it's not fine to your body. So we have to avoid refined thing. Why we have to avoid? See, our earlier people, earlier if you ask your aunties or your grandmas, so who are there in the village side, what they used to do is there were no flour mills those days. They used to have this chakki, okay, inside the home itself. And the chakki, it's not a very fine flour. It is toda mota. It is a coarse powder. So with that coarse powder, they used to make these rotis. Now, when anything is coarse, when we consume such things, it takes a time to digest. Okay? Now, whatever the glucose is released from it, whatever the protein is released from it, whatever the carbohydrate is released from it, it gets released very gradually. Okay? So very gradual release. Okay? Now, in our system also, naturally it is built. In our system, our insulin, which is there in the pancreas, also get released very gradually. Now the amount of blood glucose rise and the amount of insulin released, both are matching, both are going parallelly. And our blood sugar levels are controlled and maintained. Now, unfortunately, when we eat refined flour, now this refined flour is already digested. kind of, isn't it? So when we consume such rotis, what happens? As soon as you consume it, immediately half an hour, everything gets digested, and your blood glucose level goes very high, the peak, fast. Okay, very fast your blood glucose becomes high. Okay, but unfortunately our body cannot produce insulin with such a speed. It produces very slowly. Now there is a mismatch between the glucose level and the insulin level. Now the blood glucose levels are very high in your body, at least for one hour. Okay. Now when such chaos are there in the body, then what happens? Gradually, as the after 4 years, 5 years, or 10 years, body becomes habituate of the such chaos and become diabetic. Similarly for other things also. Preserved foods. Preserved food means, so for preservation, nothing can be preserved like that. Okay. So if we keep rice in the morning, so in the evening it becomes, not fit for eating. So people keep those things months together, isn't it? If you bring this आटा, okay, तो आटा जो लेके आते हैं, तो आटा हम घर में मतलब महीनों तक रख सकते हैं. इनफैक्ट वो गोदाम में भी 6 महीने से पड़ा है, लेकिन उसको कुछ नहीं हुआ है ना, उसको ना कीड़े लगे हैं, nothing has happened. Even if you take out and put in your vessel, तो हफ्ता रखेंगे, 2 हफ्ता रखेंगे, कुछ कीड़ा नहीं लगेगा उसको, because there is a lot of chemicals added into it, so that it will not get spoiled in short time. Otherwise, अगर आप चक्की में आपका गेहूं लेके चक्की में आटा पीस के ला के रखेंगे, you cannot preserve it for 7 days. After 7 days, you start finding a lot of उसमें थोड़े कीड़े होने लगते हैं, फिर से आपको फिल्टर करके रखना पड़ता है. So it is, you can store it for such a long period, means you have added a lot of strong chemicals into it, and those chemicals very sustainably, religiously we are eating every day. एवरी डे. तो ये सभी केमिकल्स जब हमारे बॉडी में जाते हैं, तो दे ब्रिंग ए केमिकल रिएक्शन, एंड दैट रिएक्शन इज परमानेंट रिएक्शन. तो ग्रेजुअली ये ऐसे प्रेशर होते रहते. इसलिए हमारे बॉडी में जो भी केमिकल प्रोसेस है, उनका सबका साइकिल डिस्टर्ब हो गया. ऑल दो साइकिल्स विच आर देयर इन द बॉडी गेट डिस्टर्बटेड. सो प्रोटीन का साइकिल जो था, मतलब इतना ये एमिनो एसिड्स आने के बाद उसको प्रोटीन में कन्वर्ट करके उसको मसल में भेजना था. नाउ दैट साइकिल गॉट डिसरप्टेड. नाउ एनीथिंग इज कमिंग प्रोटीन, इट इज नॉट कन्वर्टिंग प्रोटीन, इट इज कन्वर्टिंग इनटू फैट. ओके, सो वी आर गेटिंग ओबेसिटी. So such things are happening. Not only that, the food grains, they are genetically modified. Okay, so originally जो भी दाना हम लेंगे, उसको बोएंगे तो उसको मे बी उससे 100 grains आते होंगे, लेकिन now they are genetically modified. If you put such things in the form of crop, you will get thousands of such grains. So we have to produce, because economy population इतना है, हमको इतना produce करना पड़ता है, तो then we have genetically modified it. But unfortunately that puts a pressure on our health. Okay, cooked in an unhealthy way. So this we can see nowadays. So if you go to any restaurants and all, so तेल मतलब continuously चलता रहता है, बस तलते रहते हैं. Not only that, people are very crazy, they do a lot of things. तो कभी दही डालेंगे, फिर उसको पकाएंगे, उसको फ्राई करेंगे. So these are not healthy ways at all. Okay? So Ayurveda has a concept of viruddhana. Viruddhana means opposite foods. That means you should not consume such foods together. For example, meat and curd, meat and milk, fish and milk, fish, honey, banana curd, या banana with some spicy things. So you should not eat such things because they are called opposite foods, opposite or viruddhana. But nowadays we have designed the process of making the food which includes lot of viruddhanas. That it. जैसे बिरयानी वगैरह बनाते हैं तो उसमें lot of, I heard that उसमें lot of curd वगैरह डाला जाता है, you know? So that's not a healthy way. So unhealthy way of cooking it. Then unhealthy amount of eating. अगर कुछ अच्छा लगा तो पूरा यहाँ तक हम खा लेते हैं. Even डकार भी आता है तो पूरा मुंह में आ जाएगा वो. So such quantity we eat. That's not a healthy quantity. So in this way, in the modern times, our food has become such things. Then unhealthy behavior. Unhealthy behavior. So lack of adequate physical activity. अगर कोई कर रहा है तो ज्यादा ही कर रहा है, 2-2 घंटे कर रहा है. अगर कोई कर रहा है, नहीं कर रहा है तो बिल्कुल नहीं कर रहा है. So this is what is going on. That should not be there. So there should be adequate amount of physical activity. We heard recently that a lot of our very good popular actors, South Indian actors, some North Indian singers, they died while doing exercise. Okay? They died of heart attack while doing physical activity. Because the physical activity you are not doing in a right way. Okay? So there should be a right way, right quantity, right time to do physical activity, and that should be followed. So lack of physical inactivity. So if you are physically inactive, you are not enough men. Okay, you all have seen that if you are sitting whole day in the house and night when you go to sleep, you will get sleep, but not that deep sleep. Now when you go outside one day and you gone for some trip or somewhere, and whole day you were like walking, going here and there, and that night you will get a very deep sleep. Why this is so? Because the exercise physiology has that. When you do good amount of physical activity, that produces more melatonin, more endorphins, more serotonin. There are a lot of studies being done that shows that people who does physical activity have a decreased risk of developing depression. People who does physical activity have decreased risk of developing anxiety. Okay, because physical activity also has the mental effect. This is what the mind-body complex. So this is what Ayurveda says. Triguna, Tridosha. Okay, Tridoshas are body energies. But what are Tridoshas? Tridoshas are energies in our body, which governs all functions of the body. What are Trigunas? Trigunas are energies in our mind, which govern our thoughts, our emotions, our feelings, our behavior. So Triguna and Tridosha, they are connected. They have a strong relation. Okay? So when you do physical activity, you are increasing the rajas, or you are reducing the tamas. When you you are reducing the kapha. Okay, by doing physical activity, you are reducing kapha, and that kapha will reduce your tamas. That's why. And what is depression? Depression is tamas. Depression is tamas. Anxiety is rajas. Anger is rajas. Okay. So that is how physical activity contribute to our laziness. So some people are lazy. So lazy will, in fact, the Ayurveda says asya sukham swapna sukham. Asya sukham swapna sukham. So those who are indulged in just sukha of eating, in the sukha of sleeping, will develop diabetes and will develop obesity. So laziness is very, very bad. laziness is tamas. Lack of sleep, mobile addictions, all these. So these are the unhealthy behaviors that we are nowadays very commonly noticing everywhere. Then unhealthy emotions. Unhealthy emotions are being generated because we don't have much exposure to spiritual activities. Okay? There are less engagement into religious activities. So this lack of engagement into religious activities, spiritual things, leads to development of unhealthy emotions inside. Okay, that creates actually hatredness, anger, jealous, cheating others, hurting, depression, stress, boredom. Okay, boredom, loneliness are very, very common nowadays. In fact, nowadays the students in the university started committing suicide. There are a lot of cases we read in the newspaper. That a lot of students in the universities, they are committing suicide. So such a young minds. What is the reason? The reason is feeling loneliness. All of them, they say that I feel lonely. There is no trust relationship. There is no friendship. Okay, loneliness become more and more prevalent nowadays. Okay. So these are the major emotional issues that we are facing. And these all are leading to major health concerns. So these are some flow charts that I want to depict, that how the brain and our endocrine system in these unhealthy emotions leads to problem. For example, this is a stress mechanism. This is a stress mechanism. So when you are into stress, okay, so whenever we are into stress, what happens? The lot of brain activities, they stimulate our hypothalamus. Hypothalamus is it is like a gland in our brain, which is a part of the brain, but it acts like a gland, which produces a hormone called CRH, corticotropin releasing hormone. Now, what this hormone does is, this hormone stimulates our pituitary gland in the brain, and that pituitary gland produces ACTH, adrenocorticotropin hormone. Okay. These are all details I will give in the slides later. Now, what this hormone does is, it stimulates the adrenal glands, which are there on the top of our both kidneys. Okay. Now, these adrenal cortex produces and secretes lot of stress hormones. Okay. These stress hormones are glucocorticoids, mineralocorticoids, aldosterone, adrenaline, noradrenaline, all these things. So what these all hormones does, they prepare our body for flight and fight reaction. Okay. So this is a natural thing. Okay. This is a natural mechanism. Whenever we are into stress, so whenever we face any stress, body has to be ready for flight or fight response. Okay, this is a natural thing. Now, why it is there in our system? Because it is a natural thing, right? So it is there because so we are into modern era, but our ancestors were in the forest. Okay, our ancestors were in the forest, and they used to encounter a lot of lions, lot of elephants, tigers, snakes on daily basis. Now, whenever tiger is chasing, so naturally I get this signal from the eyes that, oh, there is a tiger coming. Now this tiger will eat me if I don't run. So this signal goes to my hypothalamus, and hypothalamus produces these hormones, and these hormones stimulates adrenal gland, and adrenal gland produces stress hormones. All these stress hormones, what is they prepare my body to fight with the tiger, or flight from the tiger, or just climb the tree, or run away from there. So to do all these things, what I need is I need more energy. That means I need more glucose. I need more blood pressure. I need more respiratory rates. Isn't it? And I don't need anything. I mean, I need more blood pressure to my hands and legs. Isn't it? My hands and legs needs more blood pressure, more energy, and more heartbeat. So all these hormones, what they do is they prepare my system for flight and fight response. That was beautiful. That was very good, and that has survived us so long, isn't it? So this system was there. That's why you and me are talking nowadays. Otherwise, our ancestors, I mean, the human extinguish have happened, isn't it? So this system has protected us. But unfortunately, now this system has become the cause of a lot of non-communicable disorders nowadays. How? Now we don't have any lion, tiger, or elephants in front of us. But still, this system is active. Okay, this system is becoming more active. Why? Because when I think that my wife is a tiger, when I think my boss is an elephant, when I think the traffic is terrible and this is like a snake, okay, when I think, oh, my time is going on, oh, I have to rush, so time has become a wild bull. Okay? Now every day we are chased by these things, some unhealthy relationship, some like task, competitions, time management. All these things are nothing but for yours, this system, they are just stress. They are just stress. So this system don't know whether there is a real tiger or it is a human tiger. It know only one language. If there is a stress, I will get activated. Okay. Now this system gets activated, and this system keep you prepared always for flight or fight. Now, unfortunately, you neither can flight nor you can fight. Isn't it? You cannot fight with your wife or with your husband. We cannot fight every day with our boss. We cannot fight time. We cannot fight traffic. Or we cannot flight from the traffic. You cannot run away from it. But you are continuously under pressure. Now, this has led to a lot of heart disease. This has led to obesity. This has led to anxiety. Okay, this is what is the stress mechanism. Now, what yoga does is very beautiful. What yoga does, yoga switch off this system. Yoga makes you relax. Yoga makes you feel that there is no bull, there is no tiger, there is no snake. You just be relaxed. Okay, that is what is the beauty of the yoga. So yoga makes relaxation and reverse the actions or the effects of this system. Okay? That is what is the beauty. So same thing, it is there. What I was telling is glucocorticoid. So glucocorticoid makes the heart beat faster and make these blood vessels narrow so that your blood pressure can raise up. Okay, so you accumulate, your muscles become tightened. That's why people in the IT companies and all, they have more frequent back pains because the muscles in the back become fatigued. They are always under the control, always under the tense because there is a lot of stress. Now, this is what is the modern thing so far we have seen. Okay. Now we will talk about what is our ancient perspective, how our ancestors like Patanjali, like Charaka, like Shushruta, Swatmarama, they have their perspective on the stress or on the lifestyle that we will see. So before that, so do we have any questions so far, whatever we have discussed? regarding unhealthy lifestyle or HPXCs. Any questions, please?
Sir, please repeat stretch receptors, how it will work. How it is
Stretch
work.
receptors. Yeah, can you see this muscle?
Yes, sir.
This muscle, so this muscle is like this now. Now, inside this muscle, there are nerves, there are neurons. And what is the function of these neurons is, they see whether the muscle is stretched or relaxed. Okay. Now, when, see, for example, so when I stretch this muscle, so become narrow. Okay, this muscle become like this. Now, when there is a stretch, the nerves which are there, they receive that signal and they carry the sensation to the brain and tell the brain that this muscle is under pressure, or this muscle is getting pain, this muscle is stretched. Now they ask the brain to relax that muscle. Okay, now what brain does? Brain produces certain chemicals like endorphins, melatonin, serotonin. What these hormones does is, they help to relax this muscle. Now, when brain sends these chemicals also goes to heart, also goes to stomach, also goes to brain itself and relaxes all organs. Okay. This is what is the importance of yoga, uniqueness of yoga. Okay. Understood?
Excuse me, sir.
Yes.
As you have told that asana and the exercise is not the same. So what do you mean here by the exercise? Which pattern of workout is known as exercise, as per our concept, actually?
Yeah, exercise is a muscle movement. Okay. Exercise is repeated muscle movement. Okay. Exercise is isotonic. There's something called isotonic and isometric. Okay. When we do exercise, we repeatedly move our joints. When we repeatedly move our joints, what that does is that increase the tone of the muscle. Okay, which is isotonic. So in the exercise, there is a repeated movement, and in the exercise, there is no involvement of the mind. In the exercise, it is just a limb movement or these things. And in the exercise, your heart rate goes up. In the exercise, your blood pressure goes up. In the exercise, your respiratory rate goes up. Okay, but opposite in the asana, it is not a repeated action. It is a one action, but with the stretch. It is not tonic. It is isometric exercise. Now, when we do asana, there is no heartbeat rise. There is no blood pressure rise. It is not fast movement. There is no breathing rate high. Okay. So this is how both are different. And the asana involves mind. Okay, you have to close your eyes. You have to focus on your breathing. You have to focus on your stretch. This is very important in the asana. In the exercise, that is not there.
So, like in the good behavior, in the lifestyle, you are saying that both have to be incorporated, like the exercise and yoga. You are talking about the importance of exercise also.
Yes. Exercise is also having importance. I'm not saying that. In the lifestyle, so even in the yoga sessions, so in the beginning, we say Sukshma Vyayama. We have Sukshma Vyayama, we have Sthula Vyayama. Okay, Sukshma Vyayama, Sthula Vyayama, they are nothing but they are like exercises, okay? But they also involve mind component. Okay? What is the so-called exercise is very dry. We are taking a good part of the exercise and adding little bit of yoga component and making it loosening practices. So that is having a exercise component also. But when it comes to asana, it is not exercise. Yes, one who cannot do asana or one who cannot practice yoga, they should do at least. So in order to build your muscles, in order to reduce your calories, you should do exercise. But in order to relax your mind, in order to relax your body, your organs, you should do asanas. Okay, so both have positive effect. Both have definitely positive effect, but both should be done. I'm not saying that you should not do exercise, you should do. You should know the difference between the exercise and asana.
So you are recommending both. Like somebody is going gym, that is also okay. And beside he have to do asana some extra time or other time. Or end of the exercise, he can do some asana. Is it like that? What will be the combination? Like in the days or
Yes,
in between?
combination is, yes, combination is best. If they have some set of exercise or a gym with already, and they also want to add yoga, is the best thing. Because what gym and exercise cannot do, that yoga can give them. Like deeper relaxation, like what we talked about, this HPA axis. This exercise will not help in that, but the yoga will help in that. So if they are doing both, it is well and good.
Thank you, sir.
Yeah, sir. Good evening. Good evening.
Yes.
Sir, very nice lecture, sir. Lot of information. Now, what I want to ask is, nowadays most of the yoga studios, they are air conditioned. And you said that the symptom of threshold of exercise is you get a perspiration on the forehead. Now with the air conditioner around, that perspiration may not come. That's so you are telling me we should not have only an air-cooled air conditioned yoga studio, but not the air conditioned one. That is, I mean, traditionally, ideally, it should be that way.
Yeah, air condition and exercise is not good. You should do. You will know that whether your body has done enough exercise or not. That through non-air conditioned thing. If you
Cannot hear you, sir.
using air condition and you are doing it, then you may be overdoing it. That cannot wait up to sweating, but still sweating is not coming and we are doing it. That should not happen.
Yeah, and then before we start conduct any yoga session, we must take the history of the person and also the body constituent and assess whether that person is bath type. And then if that is the case, then what we do is in a group of say 10, we say everybody do Dhanurasana, everybody do Bhujangasana. Even that is not proper. I mean, we should not tell everybody to do one asana. But
Yes.
now,
Ideally, it should not.
But you have a group of 50 people and you say everybody do Tadasana, everybody do Dhanurasana.
Yes, that should not be done. But ideally, what is my recommendation is, even if you have a group of 20 people, okay, you categorize them into say Vata, Pitta, Kapha, or Vata, Pitta, Kapha only. So you categorize them into Vata, Pitta, Kapha. You have a set of asana for Vata, Pitta, and Kapha. Okay. So when you are giving a standing asanas, so you tell Pitta people to perform this asana, Kapha to this, and Vata to this. Everybody is doing at the same time, but they are doing different. That's fine, isn't it? And that is very fascinating. In fact, that will actually help them. I mean, people will be very attracted to you if you are doing such things. And when it comes to history taking is more mandatory than, even if you are not assessing their Vata, Pitta, Kapha, that's okay. But history taking is very, very necessary. Okay. So you should clearly find out whether they are having hypertension, or they are having diabetes, or they have back pain. Especially some people, they come with like, I have hypertension or I have a diabetes, and I want to get rid of it, I want to control my glucose, and we don't like ask, and we start giving Surya Namaskara, we give many things, and their back pain get worse. Okay. And next 15 days he cannot do even Pahastasana. So that should not be there. You should clearly take history. What I recommend is clearly take their back pain history. Okay, back pain, knee pain. So based on that, you give them yoga. History taking is very, very important.
Thank you, sir. Thank you. Thank you, sir.
नमस्कार सर.
नमस्कार मैडम.
सर युक्ताहार का जो आपने श्लोक बोला वो फिर से रिपीट करिए एक बार. युक्ताहार.
युक्त आहार का सिर्फ बोल रहे हैं?
हाँ, श्लोक आपने जो भागवत गीता.
हाँ. युक्ताहार विहारस्य युक्त चेष्टस्य कर्मसु युक्त स्वप्नावबोधस्य योगो भवति दुःखः. युक्ताहार विहारस्य युक्त चेष्टस्य कर्मसु.
Sir, may I ask another question, sir?
Yes.
Sir, is there any history of using resistance or weight in the yoga? Like it's a long, it's evolved in so many ways for so long time. So we find that resistance training is very much effective for, rehabilitating the injuries and all. So I just curious whether it was in any form there was a resistance training in the yoga with any weight or any band or anything like that in history previously in the ancient time. Was it there?
No, as far as my understanding, in any texts, there is no any asanas which are assisted by some resistance. So it is always a self-practiced, not even assisted. Forget about resistance. Not even assisted asanas, because so the inception of asana or yoga was never the therapy. Okay? So it was for the spiritual growth, or it was for the higher, soul upliftment and all that. It was never for therapy. Now, recently we have modified, or we have taken some part of the yoga and we are utilizing it as a therapeutic measure. In that case, what I recommend is you can use asanas, and you can also use some resistance inducing technique in addition to asana. Just for example, in the case of stroke and all, we definitely need resistance exercises. So in that case, you can always use it. So when it comes to therapy, patient is the center, not yoga is the center. Patient is the center. You can modify yoga as per the need of the patient. It is therapy. But when it comes to hatha yoga, you have to modify your body according to yoga. Now, when it comes to therapy, you have to modify the yoga according to body. Okay. So in the therapy, patient is important, not the yoga. But in yoga in Hatha Yoga, yoga is important, not the person. It was never for a patient. So not the person. So that's why in Hatha Yoga, there are a lot of complicated asanas. Okay? You have to bend in such and such angle. You have to stretch it so forcefully. So you have to like break your body. Go into yoga is Hatha Yoga. You break yoga and make it feasible for the patient is yoga therapy. That we have to keep in mind. So you have to modify as per the need of the patient.
Got it, sir. But is that included in our syllabus? Like, I'm a certified personal trainer. I did reps India level course, so I can understand the importance of that weight training in terms of addressing the joint pains, especially, and also the bone density. Like the squat increases the bone density very directly. It has a very direct impact on that. But in yoga, as I have done the teacher's training in the yoga also, I have found that what you have said, that isotonic, the flexion and extension, that is somewhere missing. Those, the kinesiology, those are missing here. So, I mean, if it is not there, the workload and intensity, how much to use for a therapeutic purpose, then how a yoga therapist, like how they can incorporate those resistance in for rehabilitating anybody into yoga. Are we going to learn those things in this therapeutic, for the therapeutic purpose, using the resistance?
In this course, I don't think you will learn all those things. It is a very basic course where you will just learn the yoga asanas and the way of practicing and some theory part. Okay. Definitely not. What you are saying is very advanced. In fact, it is a very new branch. If people like you should initiate. See, there are two fields. One field is kinesiology and other field is yoga. So now we want to combine it. Okay. So this is an interdisciplinary practice. So in that, the person requires the knowledge of both kinesiology as well as yoga. Okay. So in that case, people like you should take the initiative and you should write the book where how can these yoga postures can be converted into a particular practice which is helpful for patients with stroke or arthritis. So this is a very appealing. This is very wonderful thought. So for that we have to both. Yes.
Sir, actually, this is the first time I have found you that you are so open to it, and you are appreciating it. But after doing yoga teachers training, I just left the gym and I just left those kind of exercises because I have learned to stick into this discipline only. This is the first time from any yoga therapist, I'm getting inspired to combine these things because I have found some those are very good.
Your objective should be your objective should be, if you're a yoga teacher or a Kaisudo practitioner, whatever, your objective should be that patient should be healed. The participant coming to you should be healed by Ayurveda, homeopathy, yoga therapy, or whatever therapy you're using. You cannot stick to one thing that my yoga therapist too, I have done so many courses, I have done PhD, and that will not work when it comes to patient. That is what sir is saying. So you have to tailor make
actually
the patient.
Even the current healthcare system, what it is patient centric. So earlier people used to fight like, oh, allopathy will work, oh, Ayurveda will work, oh, this thing will work, that. Now there is nothing. So now patient is important. What is good for patient, that we will do. If yoga is not good for a particular patient, just omit yoga. I say. If kinesiology is perfect for that patient, give kinesiology only, because the patient is important. If this aspect of the asana is helpful, if this aspect of the yoga is very good In addition to kinesiology, it is the best. So nowadays it is a trend of interdisciplinary practice, and we should promote it. For that, the person should have a knowledge of both sides. So one side, if we have a knowledge, that is not good. In fact, even not only now we are just saying it. Earlier, our ancestors, like even if you see